My husband and I and my 3 children moved to Grayslake in 1994. And it was my dream to own my own animal hospital. I didn't know how it was going to happen, but I still made it my dream. And then Dr. Craig turned this building into an animal hospital. I didn't know her, but one day I was driving by. I'm like, oh my gosh, that's my animal hospital. It's going to be my animal hospital someday. I just know it.
Since I've been with Dr. Swearingen for such a long time, I came in very easily with her. We practice very much the same medicine since she pretty much taught me how to do everything. And so opening up this practice with her was a dream of mine, to just be with her on this journey.
There was just 3 of us when we started it. And now I have 16 employees. I was growing. It was hard to be efficient with 2 exam rooms. And I thought of, people were trying to encourage me to build a bigger building. And Jordan helped me out.
We just hit it off right away and formed a really strong relationship, and then got to talking, probably 5 or 6 years ago. She kind of wanted to either expand, remodel, have a new location. She wasn't exactly sure what the path forward looked like, and so I talked to her about our GPS program. That kind of really solidified what she wanted to do here.
There was one doctor there in particular that helped me to be brave, and he had built a new clinic and then another new clinic because he just kept growing. And I thought, no, I want to stay small. I just want to be me. This little clinic is just me, but it was suffering wear and tear. Here we are, $1 million later. But I did get 2 more exam rooms, and the whole point of this was to become a more efficient flow, and that helps you to see more people. And the flow we have here is amazing, and we only have 4 exam rooms.
I think the biggest challenge was that she was confined to these 4 walls, so there was not the ability to go out. She wanted to keep her location, so we weren't looking at a new build or an expansion. So we had to take exactly what she had here and make it and reconfigure it to make it work. So she spent some time with Michael Reynolds to figure out, can we do this? Is what I want possible? Can we get, the right number of exam rooms? Can we get enough space? Can I get an office? Can we make it all work? And so I think sitting down with Michael to see yes, we can do it within this space was also very beneficial for her.
I bugged Aaron to death. And Jordan. They helped me with layouts, figuring out cabinet sizes and special builds on things. And we talked about the treatment room. That was a big part of it, figuring out the island and did I need a dental sink and, which one fit in my budget. He was very good about fitting it in my budget and knowing the equipment inside out.
Every decision they've made, they've done it very methodically and, wanted to weigh their options, and we kind of worked through, what would work best and what would fit their needs the best and come to a solution. Whether it was therapy, laser, digital x-ray, dental x-ray, all those decisions, again, there weren't a clinic that says, okay, this is in the catalog, order it for me. We always wanted to talk about it and figure out what was going to work best for them.
My staff here, they are all part of my life in different ways. My neighbor across the street has worked for me for 18 years, and Nicole's worked for me for 24. Joe's worked for me for 24 years. Dr. Marks was my technician at Hawthorne Animal Hospital. She went to vet school and then applied for a job. It's crazy, but they are all personally connected to me, and that makes them dedicated to the animal hospital. One of the reasons I wanted this animal hospital so badly was that I lived 1.5 miles down the road, and I raised my children here. We were just so part of the community, and I wanted to serve my friends and the community members. I'm very attached to them. And I just like to think of us as a boutique animal hospital with a heart. Lots of